demographics on that?
Well, certainly, if you are have been in the travel area that has been impacted by a case, then certainly you have more risk than others. Even though we know that this pandemic is global and evolving daily, but you've been in one of the infected areas and you believe that you've been close in contact or you have some of that symptoms, you're at high risk. Certainly, always we worry about those who have compromised immune systems, who are immunosuppressed in any way. But right now, we all are susceptible to a novel virus. So no one in here has any protection against a novel virus. So that's why we're trying to invoke the planning that we have here. So I would say that everyone is at risk. Those who are most at risk are those who've been through one of the affected areas. To get back to your question about quarantine, certainly we are, we're taking the guidance from not only the Centers for Disease Control, but the World Health Organization, who made the unprecedented statement that we're reaching the point where we believe that a global pandemic is afoot, because we're seeing these cases pop up all around the globe. As our case count would grow here in the United States, and as it comes close to home, we will use the tools in our toolbox, and that would include social distancing. And that may mean that more people will need to work remotely instead of going into the office to work. That may mean that we will cancel events where there's large congregation of individuals until we can get a handle around disease. We only have so many resources. We have a lot of people in the city, and we need to keep them safe. So this will be done based on the epidemiology and direction that we get from our state partners. The local health departments in this community are all working tirelessly to make certain that our surveillance is keen. We do this year round, but it has to be more than keen at this time. The first sentinel case triggers parts of our pandemic plan to say, if we get a cluster of 100 cases, it's at the time to say, maybe you don't go to that concert hall. Or if we get a cluster of 1,000 cases, maybe it's time that we look at maybe not a ball game going on or some other large event. We will make that determination with great guidance from a lot of medical and public health professionals.
How much protection does the flu virus, the current flu virus vaccination give?
What we understand is that if you receive the flu vaccine for this past season, that you are virtually unprotected against this novel strain. So it is great that you got it for human influenza that was circulating in our community, but you are just as susceptible to disease from this novel strain of swine influenza as any other individual. As it was asked earlier about vaccine preparation, vaccines are down the road. Prevention is now. We must take precautions that we know that work.
Well, Commissioner, the 24-hour or the hotline, will it be 24 hours? Or will it be staffed live for 24 hours a day?
We have a live pickup during 8 a.m. to 5, and then we have an automated line that will be 24-hour access. We will expand that as need arises and as case counts go up. But that hotline is robust at this time. It's getting a great amount of volume, and consumers and the public at large are getting information they need. I'll take one more question and I'll have to be.
Who's answering those calls? Are they doctors or just other healthcare professionals?
These are public health professionals. They include our public health nursing staff, our disease control staff, and all of our public health staff have been trained and have been, over the last 3 years, have gone through preparedness training. They all understand that we would get here one day and that they would have to invoke what they've learned. This is no longer a test. This is for real, and I'm very confident in the players that we have on the ground to respond to this public health emergency. Thank you.